If you're someone who's had a breast implant for 5, 10 years, or maybe longer, you may be due for an exchange. The average window of time is about 10 years. Reasons you may want a new implant are: the implant does get old, deflation rates start to increase the older the implant is in place. Also, malposition of the pocket. This implant has been held in a certain space, but it's active daily with your lifestyle. So the pocket does stretch, the implants do migrate, and typically along the direction of your torso, down and out. So my objective is always to rejuvenate your breasts. How do we go back in time? Well, essentially, we need to rejuvenate this pocket. So the implant gets removed, the pocket manipulated to allow for the new implant to sit in a more favorable position. And that typically means more centered and more up, providing a little more height, a little more contour. You may change sides, either going up or going down, depending on what your wishes are. The shape of the implant that we select will determine our projection, our contouring. We can use implants that are more natural, more sloping, and fuller at the base. We can also use implants that are narrower and more round to give us more height in the upper pole. Your desire as far as your cleavage line, how projected or how supple they are, will be determined by the implant that we select for you. Implant exchange surgery tends to be easier than a first-time augmentation. The reason is we're not cutting the muscle for the first time, separating tissue and stretching tissue. So your movement of your arms will be rather free and very comfortable. Sometimes pocket work is required where we have to narrow the implant pocket, which can lead to some discomfort on the outer margin of the chest. But this is very fleeting and short-lived. You'll be very comfortable within several days of the surgery and get back to normal rather quickly.